This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, April 7th, and I'm Zach Caruso. Our lead story this week is in the Journal of Addiction Medicine and is titled, Do U.S. Adults View Drug and Alcohol Addiction as a Health Condition? Participants, part of Gallup's random sample of U.S. households, completed a web-based survey that explored their beliefs about addiction. Asked if addiction is a health condition, 77% of U.S. adults agree, 16% disagree, and 6% don't know. Men are more likely to disagree than women, and those who have struggled with addiction but not in recovery were more likely to disagree than those in recovery or with no personal addiction experience. Those with less education and income were more likely to disagree. Those who disagree that addiction is a health condition are less likely to believe it is treatable by doctors, believe that medications are effective treatments, or help friends or family with addiction. Next is an article in the Journal of General Internal Medicine and is titled, You're Hoping for the Best, but Preparing for the Worst. Discussions of starting buprenorphine in the context of fentanyl use with clinicians and people who use fentanyl. Researchers interviewed clinicians and people who use fentanyl, or PWUF, to identify barriers to buprenorphine initiation in the context of fentanyl. Barriers identified included a fear of withdrawal, lack of standardized buprenorphine initiation, and cheap and easy access to fentanyl. Clinicians expressed concern that experiencing precipitated withdrawal would deter patients from using buprenorphine in the future, so they focused on preparing patients for its potential severity. PWUF wanted information on the likelihood of precipitating withdrawal. Lack of standardized initiation complicated clinicians' decision-making, while PWUF often relied on non-clinician sources to guide who they initiated buprenorphine. Researchers found that compassionate and clear communication did facilitate initiation. Our next article is in the Journal of Addiction Medicine and is titled Stimulant-Induced Psychosis, a comparative systematic review and meta-analysis of psychotic outcomes from therapeutic and non-therapeutic use of stimulants. This systematic review and meta-analysis of stimulant-induced psychosis, or SIP, identified 77 studies that met inclusion criteria. 9 studies concerned therapeutic use of stimulants and 68 addressed non-therapeutic use. In therapeutic use, the incidence of SIP was 0.6%, typically with prolonged treatment, and usually resolved after discontinuation. For non-therapeutic use, the prevalence of SIP was 33%. Non-therapeutic use involved high doses and often administration intravenously or by smoking. Non-therapeutic SIP was more severe with persecutory delusions and hallucinations. Most resolved within a month, 9% had symptoms lasting greater than 1 month, and there were reports of relapses and flashbacks. Despite the low incidence of SIP with therapeutic use, the authors were concerned given the widespread and increasing prescription of stimulants. Our next article is in JAMA Network Open and is titled Slow-Release Oral Morphine versus Methadone for Opioid Use Disorder in the Fentanyl Era. This comparative effectiveness study examined 4,000-person trials of slow-release oral morphine, or SROM, versus methadone for the treatment of OUD in British Columbia, Canada, from July 2017 to June 2024. Researchers utilized data from the Vancouver Coastal Health Authority, which is publicly funded and covers areas that have been significantly impacted by overdoses. During the study period, both SROM and methadone were prescribed by clinicians and dispensed via witnessed dosing at community pharmacies. The primary outcome was treatment discontinuation at 12 months, with secondary outcomes of treatment adherence and all-cause mortality. The intention to treat analysis had high rates of treatment discontinuation in both groups. The median duration of treatment for methadone was 8 days versus 3 days for SROM. During the study period, 121 deaths occurred, with an overall mortality rate of 8.2% for the SROM group and 7% for the methadone group. About half of the deaths were opioid-related, and only 2 deaths occurred while participants were taking MOUD. Next is an article in Frontiers in Psychiatry titled Association Between GLP-1 Receptor Agonist Use and Substance Use Disorders Among Individuals with Type 2 Diabetes or Obesity, a nested case-control study in the All of Us research program. Prior animal and human studies have shown some promise for GLP-1 RAs for use in substance use disorder or SUD treatment, but have been limited in size, follow-up, and generalizability. Researchers used a nationally representative longitudinal health dataset to conduct a case control study and evaluate association between GLP-1 RAs and incidence of alcohol use disorder or AUD, opioid use disorder or OUD, nicotine use disorder or NUD, cocaine use disorder or CUD, or any SUD. Researchers found GLP-1 RAs were associated with lower odds of AUD, OUD, NUD, CUD, and any SUD. While additional research is needed, including randomized control trials, the authors note these findings support the potential use of GLP-1 RAs across multiple disorders. Our next article is in Nature Mental Health and is titled A Computational Mechanism Linking Momentary Craving and Decision-Making in Alcohol Drinkers and Cannabis Users. This study tested a hypothesis that momentary craving and reinforcement learning influence each other during substance-related decision-making. 2 substance-using groups with moderate to high addiction risk levels performed a decision-making task in which they received a group-specific addictive cue or monetary outcomes and reported moment-to-moment subjective craving. Computational modeling revealed that momentary craving biased substance-specific learning rate in both groups, but in opposite directions. Expected values and outcomes jointly influenced elicited cravings across groups and decision contexts. Regressions incorporating model-derived parameters best predicted alcohol but not cannabis addiction risk scores, supporting the selective utility of using these model-based parameters in making clinical predictions. Together, these findings provide a computational framework that accounts for the interaction between craving and maladaptive choices across addictive domains. Next is an article in Proceedings of the National Academy of Sciences titled Predicting Individual Incubation of Opioid Craving by Whole Brain Functional Connectivity. Relapse driven by craving is a central challenge in treating opioid addiction. Using resting state fMRI and connectome-based predictive modeling, this study identified a whole brain connectivity pattern that predicted incubation of oxycodone craving after voluntary abstinence in rats. Connectivity changes during abstinence predicted the magnitude of incubation, measured by increased oxycodone seeking from early to late abstinence. The predictive connectome involved interactions among cortical, basal ganglia, insular, hippocampal, and sensory motor systems. Pharmacological inactivation of the dorsomedial striatum modulated connectivity strength within this network, demonstrating a causal role of the connectome in incubation of craving. These findings identify a brain-wide marker of incubation of opioid craving and provide a translational framework for developing targeted interventions and monitoring therapeutic outcomes in opioid addiction treatment. Our final article is in the Lancet Regional Health Americas and is titled Rapid Hepatitis C Test and Treat with Peer Support at Opioid Treatment Programs, or Rapid HCV, a hybrid effectiveness implementation type 1 randomized controlled trial. Rapid HCV is a multi-center open-label randomized controlled trial which was conducted at 5 opioid treatment programs, or OTPs, in the US and Canada between August 2021 and November 2023. Participants were randomized to either on-site OTP-delivered HCV testing and treatment with peer support or referral to off-site specialist care. The primary outcome was HCV treatment initiation within 12 weeks, with secondary outcomes of time to HCV treatment completion, and sustained virological response measured, or SVR, 10 to 36 weeks after end of treatment. Participants were randomized with 122 eligible for treatment and included in study analysis. In the rapid HCV arm, 89% initiated treatment compared to 21% in the referral arm. Participants in the rapid HCV arm also had significantly sooner treatment initiation. Of those who initiated treatment, there were similar completion rates and SVR among both settings. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.